Hi, good afternoon. This presentation is Becoming a Family, Tips from a Pediatrician for Expectant and New Parents. My name is Dr. Amy Lau. I'm a board-certified pediatrician from Hoag Medical Group. So now you're pregnant, so what's the next step? So the first thing you do is you pick a hospital where you plan to deliver. Most of the time it depends on your OB. Wherever your OB has privileges, she'll let you know which hospital that you're going to be going to. You should be familiar with the hospital you want to go to, know how to get there, how close it is to where your house is. So once you figure out which hospital you want to go to, the next thing is to pick a pediatrician. Why is this important? Because once you have a baby, your pediatrician is going to be your number one speed dial. This will be an 18-year relationship. So most pediatricians will have what we call a mother-to-be appointment. It's a free appointment that you can make where you can meet your pediatrician and have a prenatal consult. So when you make these appointments, you be prepared to ask many questions during the appointment. When you go there, it gives you a chance to want to check out the clinic. And some of the questions that you want to ask your pediatrician what am I looking for in a doctor for my child? What's your doctor's philosophy? Big thing is to make sure the doctor that you pick is in network for your insurance plan. Because if it's out network, it's going to cost a lot more to see the doctor. And the number one thing is location, location, location. Finding a pediatrician is like real estate. You want to find a pediatrician that's close to you, especially when it comes to if your baby gets sick on a Friday afternoon and you're trying to get through rush hour traffic to see your pediatrician, you want the pediatrician to be close enough so that you could get there in time to see your pediatrician. So in the prenatal consult, the most important thing for you to figure out is how accessible is your pediatrician. So important questions to ask is hours of operations. You have to know when the office is open for patients. You want to know what kind of method of communication you could have with your pediatrician. After the office closes, can you still call to ask questions? Do you have a triage system, like a triage nurse answering system? Can you page the doctor at night if you're really worried about your baby? Can you send non-urgent questions via email? You also should ask about appointments. What are the average length of an appointment? Do they offer same-day appointments? Type of practice is very important too. So is a group practice versus solo practice? Knowing the pediatrician hospital privileges makes a difference too, because depending on where you're going to deliver, you want your pediatrician to be able to go to the hospital to see you when baby's delivered. It's very important that the pediatrician is a good fit for you and your child. And to do that, you want to talk to the pediatrician so you can see the communication style. You can see the philosophy of care. It's good to see what the staff is like, especially your front staff who's going to be making the appointments and directing your calls. It's good to go check out the clinic and see how far the clinic is from your house and to see what the facility looks like. During your prenatal consult, this is a great opportunity for you to ask plenty of questions. So your partnership with your pediatrician starts at the hospital. When the baby is born, within 24 hours, your pediatrician will be going to the hospital to check your baby, examine your baby, and check for baby's weight, check to make sure baby's doing okay, see if there's any feeding issue. Most importantly, we're there to answer your questions. So what to expect when you're close to delivering. So when you're in labor, you're going straight to the hospital, and then you're going to be calling your OB or midwife, and they'll be meeting you at the hospital and assessing you. So I know all of you guys have probably a birthing plan. So remember, when it comes to babies, expect the unexpected. Whatever plan you have to be flexible, because the most important thing is to get the baby out safely and healthy. So sometimes it might not work out. Your birthday plan won't come out like how you planned. Most of the time, I know that you want to have a vaginal delivery, but sometimes you have to have a C-section to get the baby out safely. So part of the medical team that's going to deliver your baby is a big team. So when you're at the hospital, you either will have the OB/GYN or a midwife to deliver your baby. There will be labor and delivery nurses to help out. There will be anesthesia. If it's a high-risk delivery, or if at any point the OB think that we need help, the OBs will be calling the pediatrician or neonatologist to be at the delivery to ensure the safety of your baby. So once baby's out, there will be medical treatment given to your baby right after delivery. The 3 medical treatments your baby will be getting will be hepatitis B vaccine, vitamin K injection, and erythromycin ointment. So let's talk about vitamin K. Why is vitamin K important? Vitamin K is important because it's needed for blood to clot properly. People don't make vitamin K on their own. It's obtained through good bacteria in our intestine. Newborns don't have much vitamin K in their body because their intestines do not have good bacteria yet. So that means that all newborns have low vitamin K due to breastfeeding, and the cord blood contains very little vitamin K. And all newborns are high risk for what we call vitamin K deficiency bleeding. This occurs when babies cannot stop bleeding because their blood doesn't have enough vitamin K to form a clot. The bleeding could be very serious and can cause brain injury or death. It can occur any time during the first 6 months of life. But it's easily prevented by vitamin K injection right after delivery. Oral vitamin K does not offer the same level of protection as the injection. That's why we do the injection right at delivery at the hospital. And so how is it given? It's given by injection to the thigh. It's preservative-free, and this is not a vaccine. Hepatitis B. So why is hepatitis B vaccine important? More than 1,000 newborns are diagnosed with hepatitis B each year in the US. If a newborn gets hepatitis B under 1 year, there's a 90% chance that they will have chronic disease, which could lead to end-stage liver disease, liver cancer, and death. The most common way a newborn could get hepatitis B infection is from the mother, but household transmission is also not unusual. Hepatitis B virus is spread through infected bodily fluid. So common misconception is that hepatitis B vaccine spread through blood, sexual contact, or IV drug use. While hepatitis B virus can transmit through these modes, majority of children actually contract hepatitis B virus through interpersonal contact. So hepatitis B virus has been spread through personal items such as toothbrush or washcloth. So the AAP and CDC recommend that infant receive the first hepatitis B vaccine within the first 24 hours of life. Vaccine protects all infants from all possible hepatitis B infection sources, even if their mom are hepatitis B positive. So how's the hepatitis B vaccine administered? It's administered by injection to the thigh and is preservative-free. The last thing that the baby will get will be erythromycin ointment. Neonatal conjunctivitis is an eye infection caused by bacteria. Mother's birth canal normally has bacteria. The newborn eyes can become infected during the delivery. These infections can be very serious, and some infection could lead to blindness. How is it applied? So once baby is delivered, it's applied to both eyes right after delivery to reduce risk of newborn eye infection. So there are some screening tests before baby is discharged from the hospital. First screening test is the cardiac screen. We do the cardiac screen to check, and if baby failed cardiac screen, we do a full echo to make sure the heart is normal. We check for hearing, because it's very important to detect if baby have any hearing problems. So they will do the hearing screen in the hospital before baby gets discharged. If the baby failed the hearing screen, then the baby will have more extensive hearing tests done outside the hospital. So they'll make an appointment for you if your baby failed the hearing screen. There's what we call the newborn screen. This is a blood test that's done the day after baby is delivered. It checks for 12 different diseases in babies. These are metabolic diseases that we don't detect early. It could cause mental retardation in babies. So that's why we do this. It's sent to a state, and the state do all the screening tests. And then within 3 to 4 weeks after you go home, the state will send the results to your pediatrician. Your pediatrician will let you know the results of the newborn screen. The last important thing is to do the jaundice check, because babies are high risk for jaundice, so your pediatrician will make sure they check baby very carefully for jaundice, and if there's anything that they need to do, they will treat the jaundice with phototherapy. So once you go home, once the next time you're gonna go see your pediatrician, you pretty much will see the pediatrician quite often the first year of life. So these are what we call well visits. The first well visit is when baby's 3 to 5 days old. When you go to your well visits at the clinic, the pediatrician will be checking the baby's weight. We'll discuss nutrition, growth, physical exam, prevention, development, and then during certain well visits, baby will begin vaccines. And during this time, you'll get to ask all the questions that you need. Every step of the way, your pediatrician will be answering your questions, because you'll be seeing your pediatrician quite often. You're seeing your pediatrician at the 3 to 5 day mark, the 2 week to 1 month mark, 2 months, 4 months, 6 months, 9 months, 1 year, and any visit in between if necessary. So I know it's overwhelming knowing that you're having a baby and trying to prepare. So there's out in the world, there's a lot of baby books out there, and there's a lot of information on the internet. So I want to share with you some of my favorite books that might be helpful. The first book most people would have would be this one. Since you're pregnant, this is the most people when they're pregnant get this book. What to expect when you're expecting. And then after that, there's another book that's what to expect the first year. The two books that I really do like that's very easy to read is Baby 411 by Dr. Brown. She's a pediatrician that wrote this book with Dennis Fields. She does it in a very easy question-answer format. So when you flip through this, it goes through all topics that you want. Breastfeeding, development. So there's different sections that you could read. And it's great for, when you're trying to figure out, formula, breastfeeding, development. So there's a lot of information in this book, but in a very easy format. There's a baby 411, and then when your baby gets older, there's a toddler 411. And I know that baby products are very confusing. When you go to a baby store, like Baby R Us, there's a lot of products out there. So this actually is a very nice, handy book to have. It's called Baby Bargains. It's like the consumer report for parents for baby products. So if, for example, if you want to look up car seat, it'll tell you what car seat is good, what car seat is very expensive, what car seat's not that great. So whatever product you could think of, it's in here. And they'll tell you, is it important to get or not. And the last page, there's an index that will help you figure out like what typical, to register for the baby registry. So what products are good that you should put on your baby registry. So this is very good, especially when you're pregnant, when you go to a baby store, it's very overwhelming with all the baby products that's out there. Other baby books that's also good is Your Baby's First Year. This is the book that was the American Academy of Pediatrics have set out. Has lots of good information for you. The last one, which I have the Happiest Toddler on the Block. The one that you should get first would be the Happy Baby on the Block. This one is a very simple book to tell you all the 5 S's to help calm down a baby. It's very helpful for brand new parents. And then Hoag actually have a very good baby line. So once your baby is born, if you have any questions, especially about breastfeeding, there's a good phone number you could call. So it's 949-764-BABY. And then the website, if you want to look at a different website, there's healthychildren.org. That's really good that talk about baby safety. If you want to prepare about vaccines, there's cdc.gov vaccines/parents. So it's a good website to read about vaccine. Safety.org is a great website that help you with safety, trying to figure out what to do for like car seats, that kind of stuff. And then the Circle app by Hogue is good for pregnancy tracking and parenting tip. And if you want to start preparing, there are great prenatal classes out there. To me, the 3 most important prenatal classes you should take, number 1 is breastfeeding. And so a lot of these classes, make sure you get your partner involved too, because breastfeeding could be very difficult at the beginning. So it's good to go with your partner, so your partner could also listen in on you and help you out when you're breastfeeding. Infant CPR is very important to know. Anyone who's going to be taking care of your baby, nanny, grandparents, they should be also taking this infant CPR class. And the last one, installing car seat. Install cars, 80% of first-time parents don't install their car seat properly. So that's why this class will be very important for you to have. So this way I could show you how to install your car seat, keeping your baby safe. And then there's a lot of locations where you could actually bring your car seat to be examined to make sure that your car seat is installed safely. So there's a lot of things that people worry about for once you have a baby or you're trying to prepare for a baby. You can read a lot of information on the internet. It could be very overwhelming. You're going to have lots of advice from parents, from friends, from girlfriends, from your mother-in-law. So a lot of time I tell people, try not to be so overwhelmed. Relax. Trust your parental gut instincts, your gut feelings. And the most important thing is, if you're worried about anything, do not Google any of the medical condition about your baby on the internet. Because you do that, you're going to freak yourself out and you're going to over worry. The most important thing is call your pediatrician. I'd rather have you call me even in the middle of the night than for you to read stuff on the internet, and then by the time I finally get to talk to you, I will have to talk you off a ledge. So please don't Google anything, ask your pediatrician. Because if you're worried, it's best to talk to your pediatrician so your pediatrician can decide, hey, this is nothing to worry about, or bring your baby in, let me examine your baby, and let's try to figure out what's going on. Being a parent is going to be one of the hardest jobs that you'll have, but it will be the most rewarding. So my big advice to you is enjoy every single moment. Your baby's going to be so precious, and it goes by so fast. So really enjoy this moment. This is going to be a grand adventure with you and your partner once you have this baby. You don't know what true love is until you have a child. And once you have a child, you'll do anything for this child. And my job as a pediatrician is to make sure that I help you through the ups and downs of parenthood to make sure we keep your baby safe and healthy. Any questions? Okay, I guess we're done here. My name is Dr. Amy Lau. I'm glad that I could be here to help answer your questions and guide you through tips to prepare you to have your new baby in the future.